Okay, Pookie, what are we gonna sing today? What album are we gonna make? You start us off. Brrr, bomb.
I cry. I cry even at night.
She told me that
Hi there.
postpartum would hit her out of nowhere at times.
Breaking at 6, an officer was involved in a shooting.
She just had this look. I can't describe it. It just seemed like something was going to happen.
Nope. Whoa!
She turned and came at me, and I thought she was going to kill me, so I shot her.
Independence police say 2 people are now dead after an officer-involved shooting. One of them, a child.
She's camera shy.
They asked for a mental health co-responder.
Maybe she could talk to the mom and get her to hand the baby over or something. So anyway, that's why she was coming.
They asked for me to bring Heather up. She's our co-responder.
And they had to retreat.
I opened the door. I heard someone yell. That's when I heard the shots.
I mean, it's no secret that we have a mental health epidemic across our communities.
There's a huge demand for mental health co-responders.
They are an invaluable resource.
I started reporting on this officer-involved shooting.
Whoa!
And it turned into a story almost completely about mental health.
You're not a problem to us, not one bit. You are dealing with people on a really bad day, and they're calling 911 and they're in crisis.
What's story 1?
Story 1 is the day.
It's Officer Cox with the Independence Police Department, along with the property manager of this complex. Can you open the door, please?
The family of Destinii Hope, of Maria Pike.
So, we need to step in and talk to you, and we need to talk to her.
Since the very start of it, was frustrated, sad,
Whoa!
and questioned what happened in that room.
Anyway, so
She's saying she was being attacked.
things at me. And then here goes.
Talisa Combs, the grandmother of baby Destinii, was there at the apartment complex to do a welfare check on baby Destinii. Talisa Combs was alleging that Maria Pike was assaulting her that day.
She just kept on throwing things at me.
Police officers found Maria Pike and baby Destinii in that closet.
Hi there.
It was sort of a makeshift baby's room.
What's your name?
Maria Pike didn't say a single word in the body camera footage that we saw, only hand gestures and head nods. And police officers noticed that something wasn't right.
If anybody else close, can you start them this way, please?
They asked for a mental health co-responder.
You have somebody else coming?
I do.
Okay, who's coming? Who was it?
It's Derek.
Okay.
The mental health co-responder and the officer that they were with were walking into the apartment as shots were fired. They were on the edge of offering help.
Whoa!
She turned and came at me, and I thought she was going to kill me, so I shot her.
My mind as a twin can't comprehend that I'm not going to see her or hear her again.
And in conversation with Maria Pike's twin sister, she told me that her sister struggled with postpartum depression.
Pookie and her mama. Okay, Pookie, what are we gonna sing today? What album are we gonna make?
I would say less than a minute later, the co-responder could have been introducing themselves to the situation and trying to figure out a way to help.
She's camera shy. She usually has a lot to say.
I wanted to learn about the opportunities that co-responders have in situations like this.
You don't want anyone hurt. That's the main goal.
624 round.
Heather Hayes is a co-responder. She makes it her mission to connect people to services, to say, hey, I'm here to help.
Meeting people where they're at and supporting them in that moment, that you've made it on a bad day, you're gonna make it, you're gonna be okay, and just connecting them in the community in that moment.
Heather was the co-responder who was walking into that Independence apartment complex just moments before the officer involved shooting.
Yeah, I want to see if 44 is able to make a connection to resolve this.
Who is 44?
That'd be Heather. Hang on, can you stay right here, please?
Police, social work, people, all unpredictable.
She said she really didn't have much to add because she wasn't in the room. Heather said some of the biggest difficulties that they face is just navigating the system.
That's one part about my job as I love, is talking to families about, like, I'm gonna be really clear, this is a system, it stinks, but we can navigate it together and figure it out.
This is Heather. This is a co-responder with comprehensive mental health.
These situations that they deal with on a daily basis are complicated.
Don't you live with your grandma?
Intense, emotional, and even dangerous in some cases.
Okay, gotcha, cool.
Co-responders stay in the police officer's car.
Can I get out?
Yeah.
Until the scene is clear, until an officer says, hey, it's safe for you to come and talk to this person.
People are unpredictable and it could be unsafe, but we just have to, you know, listen to them and do what they're telling us to do. Just because something's going on doesn't mean it's safe for us to go in that moment and help somebody.
I'm here today to give a final update on the officer-involved shooting that occurred on November 7th, 2024.
Police Chief Adam Dustman of the Independence Police Department, about a week after the prosecutor's office decided not to charge the officers, held a press conference. I made sure to ask the police chief the value that he saw in co-responders.
They are an invaluable resource to, and really have changed the way we police all across our professions.
Independence has 230 sworn officers and only 3 co-responders. So the co-responders can't be everywhere all at once. There's a huge demand for mental health co-responders or just mental health services in general. The series is called In Crisis, A Search for Solutions. We're looking for solutions to the mental health crisis.
Tell me about story number 2.
Story 2 is called Every Day.
Police department.
The shooting of Maria Pike and baby Destinii
Hang on, can you stay right here, please?
is just a snapshot of what police officers see every day.
Well, when we're done. All right, okay. Yes, sir.
Blue Springs, Lee Summit, Grandview, Raytown, and Independence all have co-responders and mobile crisis responders. Co-responders are trained in social work and mental health.
How far did he make it? Where's Britnell?
He is...
In the Independence Police Department, they ride alongside in the same vehicle as police officers. Co-responders don't wear uniforms, they don't have guns, they look like what you and I look like outside of work, plain clothes, easily approachable.
Male.
A co-responder is there to make a connection, to offer them services, and to just say, hey, I'm a listening ear. We followed along behind a police officer and the co-responder who was with them that day, and we saw how they interact with the public on 2 very different calls.
I'm 10-8 with the CIT responder.
Coleman Whitaker is an officer with Independence Police Department.
31 to 32 or 34.
He also appreciates having a co-responder there with him.
It's a lot better than just trying to do it by yourself.
Because that's their expertise.
You can have resources and you can call people on the phone, but having that tool and having that, you know, usually seniorized ear in terms of like CIT stuff is just so much more valuable than just trying to be out here just by yourselves.
Officers are reacting pretty positively to having these co-responders within their departments. In 2024, MARC, the Mid-America Regional Council, put out a survey to police departments. 83% of officers responded to that MARC survey saying co-responders help them do their jobs. Heather is a co-responder with the Independence Police Department. The team in Independence got a call that said someone had left a hospital before being discharged. They were being treated for mental health needs.
This is Heather. This is a co-responder with comprehensive mental health.
The officers were trying to locate that person to figure out why they decided to leave.
So what can I do to help you get to where you would like to be?
And where they could take them.
When you get out of the hospital, I'll help you with all that other stuff. It's literally just making the connection and meeting him. Oh, now I see his face. Nothing drastic happened on my end, but it's just being present.
They're saying friend is suicidal.
The second call that we got was a bit more emergent. Someone had called the police department saying they were worried that someone was going to attempt suicide.
They're all going to be so very angry with me.
That's okay. It's okay. You're doing the right thing by checking on her. It's okay.
Officers were looking around this parking lot trying to find someone that was in their car.
Hi. How are you?
She had been living in her car.
Somebody's just worried about you.
Pretty concerned.
Yeah.
She said that she hadn't eaten in a while.
You haven't eaten today? or yesterday?
What really stuck with me was the woman said that she felt like a burden.
Well, you're not a problem to us. Yeah.
That's why these resources are here.
Yeah, you're not a problem to us.
It was, in that moment, I could see that she was connecting with that person who needed her help.
We have a crisis center that you can spend the night at.
They walked her through where she could find shelter that was outside of her car.
CSL has food too.
They tried to connect her to a place where she could get some food.
Are you currently thinking about harming yourself in any way right now?
I was.
Okay.
That's not a question that you can really dance around. You want a clear answer.
You need help 24/7, you call 988.
Heather told her about the 988 crisis hotline.
Yeah.
Heather wanted to leave knowing that this woman had the knowledge to help herself if those thoughts arose again.
If those thoughts returned and you got overwhelmed, would you call them for me, please, and ask for help?
And if you need us, you can always give us a call too.
They responded to around 2,000 calls last year, and 869 of those, they were able to connect people to services. That's 41% of the calls that they went on. That's really the goal of this program and of co-responders, is to connect people to services.
And let them get checked out, and then we'll figure it out.
Co-responders are more than just a in-the-moment type of response. They are in it for the long haul.
He called Grandma. Grandma said he's a voluntary admin.
Okay.
You help one person and they're going to tell other people. So it just opens that door and improves our access for people in the community.
Julie Pratt is the regional director in charge of comprehensive mental health services and rural behavioral health. The grant from the federal government runs out in 2026. I wanted to know if these programs are going to continue after the grants run out.
If that goes away, this is not something that will go away for us. We will continue to have these positions in place. They're extremely valuable.
And get a case manager that can kind of help you with all this stuff.
I think this was a life-saving call.
But I want you to say that if those thoughts arise, you'll call for help again.
Heather and the police officers that were there,
we just want to give you some help
and potentially change the trajectory of this person's life. I call that life-saving.
What's the name of story number 3?
The early days.
Add car 315 to the overdose on Raytown Road, 470.
There's a new pilot program within the Kansas City Fire Department and through Rediscover, which is a mental health service.
It's going to be on 470 or on Raytown Road?
This new pilot program is partnering a mental health co-responder with a community paramedic in South Kansas City.
Car 315 is in the area.
Scott Patton is a community paramedic with Kansas City Fire Department.
I read the dispatch notes, see if there's any overt information.
Hannah is dedicated to mental health service alongside the community paramedic.
Supporting our community and those who struggle with mental health really supports everyone.
They try to understand what's going on with them physically and mentally, and then they connect them with the right services.
We do have the opportunity to spend the time that it takes for people in crisis to come to that conclusion themselves that there are other options than going to the hospital.
They only do it one day a week. There's not any additional funding for it, but they're seeing what they can do in a short amount of time with limited resources. They were able to respond to 155 calls in 2024.
Do you feel like you guys are making a difference?
Absolutely.
Yes, absolutely. I agree. We're making a difference. I mean, one person at a time. It's hard to imagine if we were 24 hours a day, that could be a huge impact. We have a call.
Oh, we do have a call.
The co-responder and community paramedic actually got there first.
Car 315's on the scene.
So they were able to talk to the patient and assess their needs. The co-responder team could handle it on their own. So that ambulance was able to go back to their firehouse and be ready to help somebody else.
You're leaving this person who may or may not be very stable in their life to try to deal with the situation on their own after they leave. And that just has never, ever worked. So having us come in and virtually guide them through the system so that they can get connected to the resources that they need eliminates having to go to the emergency room, eases the pressure on the emergency room, on the fire department, on the police department, and when we can get them all back in service to do what they're supposed to be doing.
I asked him if they should expand the program, and he had such a succinct answer.
This could be a fourth response because there's just enough of those calls out there to make it happen. Until 988 becomes as popular as 911, this is going to be needed.
Rediscover wants to show that there is a need for something like this, and potentially cities can see this program and model their own after it because Rediscover and KCFD have identified a need.
And story number 4?
We're calling it Maybe Someday. The idea that 988 will someday be used as widely as 911.
Hi, this is Tina with Rediscover, and I work closely with the crisis line.
988 is the national crisis hotline in the United States of America.
You've reached the 988 Suicide and Crisis Lifeline.
There's a lot of people that call 988, 14 million people since it started in 2022, and those numbers are only continuing to grow. But with anything new, you have to get the word out, and that's still a hurdle that mental health service providers are facing.
All right, I think we're ready to roll.
All right, let's roll.
These mobile crisis responders,
40-year-old male, suicidal, possibly intoxicated,
are going to people who have called.
Hello, this is Jara with Rediscover. We're with the mobile crisis team at 988.
Meeting them wherever they are at to address their mental health needs.
We'll be there in about 3 minutes.
They're the front lines of that mental health response.
The goal with all these services is to meet the person where they're at, both physically and emotionally, to provide the best support we can.
Heather Mason helps run the mobile crisis response program with Rediscover. They are very busy and they're only getting busier, 300+%. That is a lot, and they're trying to grow these teams as quickly as they can.
I just look, as long as we're increasing our services, I would say that's a success as well.
So seeing the numbers increase for calls of service is actually a positive thing for you.
Yeah, I would say so, because one thing is, yes, we want to divert and they talk about reducing calls for service, but what we're really finding is that we're inserting ourselves on more calls than ever before that may have not hit our radar.
Thank you so much for calling 988.
Mobile crisis responders are diverting calls from police and fire departments.
I would like to contact him tomorrow if there was any chance.
While connecting people in crisis to mental health services in their community.
And you know, we're always here for you, and whatever we can do to help, we will certainly do so.
Rediscover and the mobile responders collect data to show where people in crisis go after they call for help. In 2024, almost 30% of the crises they responded to were resolved at the scene. Just 16% of people needed further medical attention at a hospital, and only 3.4% of responses ended by contacting law enforcement.
I'm really grateful for being able to meet people where they're at and for them to allow me to come in as a stranger and ask intrusive questions and try to provide resources.
They don't have flashing lights on their cars, they don't have sirens, they're wearing plain clothes. It is like someone who you know has just shown up to your house to talk to you. It's a really approachable way to have tough conversations.
It shows that we care. It shows that we're willing to put in the extra work to help them get to where they need to be, and it just gives them a compassionate person to walk through that with. Sometimes all somebody needs is that initial conversation and feel validated, and that may instill some hope.
If you or someone you know is in crisis, but you don't need immediate help from a medical team or police, you can call 988. When you talk to someone, ask for a mobile responder. They'll come and talk with you and walk you through all of your options, including ongoing mental health services.